Hi, my name is Kristen. I'm going to be your nurse today. We're going to be doing an assessment of your head and neck.
Okay.
If you have any pain or anything, discomfort, just let me know. We'll stop. We've already went over your past history and you have no complaints of any past injuries or reoccurring headaches, correct?
Correct.
All right, let me just wash my hands. All right, first I'm going to check your head. It's normocephalic. I'm going to check your frontal, parietal, and occipital prominences. They're present and symmetrical. Okay, next I'm going to check your scalp and hair. You have no problems with hair loss or scaliness?
No.
Okay, it's full thickness. I don't see any lesions or abnormalities. Okay, good. Now I'm going to check your face just for lesions, edema, and swelling. There's no abnormal pigmentation, and it's symmetrical. Good. Okay. Now I'm just going to make sure your eyes are symmetrical with your ears. Your ears are symmetrical, nose, and mouth. All right, all your facial movements are smooth and coordinated, and you have a variety of expression. Okay, now I'm going to check your eyes. If I could have you stand, hold this piece of paper over your right eye and read line A.
D, A, C, B.
Okay, now with your other eye, read line C.
K, L, M, G.
Okay, thank you. Have a seat. Okay, if you could just look at me, I'm going to check your pupils. Good. Good. Pupils are equal. No redness. All right, good. Now I'm going to do a finger test. Just when you see my fingers out of the corner of your eyes, point to them, okay? Good. Good. I'm going to do it one more time. Good. All right, good. Okay, now I'm going to check your nose and just have you blow out lightly. And the other side. Okay, now if you could look up, check the inside. No deviation, no swelling. All right, good. Okay, now I'm just going to check your temporal artery. Feels smooth and firm. Is there any tenderness? Does it hurt?
No.
Okay, now if I could just have you open your mouth and close. Open and close. Okay. Now I'm just going to listen for any bruits with my stethoscope. Okay. All right. Now I'm going to check your mouth. I could just have you open. Don't see any lesions, no swelling. It's pink in color. Say ah.
Ah.
Okay, good. Okay, now I'm going to palpate your spinous process. If there's any pain, just let me know.
Okay.
There's no tenderness.
No.
All right, good. Okay, now I'm going to check your range of motion in your neck. If I could just have you put your neck to your chest. Good. And have you look over to your right shoulder. Good. And now your left. Good. Now if I could have you just lean your head towards your right shoulder. Good. And now your left. Good. And then I could have you look up. Good. There's no limitations. Now if I could just check your trachea, which is midline, and your hyoid bone. Okay. And now I'm just going to check your pulse. Okay, good. And then we're almost done. Now I'm just going to check your lymph nodes, see if there's any swelling or tenderness or if I can feel any. Okay, good. Okay, the last thing we're going to do is we're going to check your thyroid. I'm just going to have you swallow water, so just when I ask you to, put some water in your mouth. When I tell you to swallow, swallow.
Okay.
Okay, go ahead and take a sip. And swallow. Again. Okay, good. And have you look to the right? Go ahead and take a sip and swallow. Okay, now the other side. Look to your left and swallow. Okay. All your skin's intact, and that completes our assessment.
Thank you.